Neuropsychology is a specialty profession that monitors behavioral and cognitive changes in individuals with known or suspected brain injury. We use objective assessment to evaluate memory, language, reasoning, problem solving, motor functioning, attention, and the like. Those results are compared to similar peers, so we capture where that individual is performing on a given range. Different diagnoses that we evaluate include ruling out or ruling in dementia. What type of dementia may the individual be experiencing, and once that's identified, what stage are they in? We also evaluate stroke, traumatic brain injury, including concussion from sports or other incidents and accidents. We'll evaluate multiple sclerosis and different things. They have a certain cognitive profile, oftentimes once things progress later on. We'll also evaluate occasionally neuro-oncology patients as well, whether it's due to brain cancer itself or the related treatment. The clinic evaluates individuals on an outpatient basis through community referrals such as neurology and psychiatry. We're also heavily involved with the rehab unit as well, up on 5. Up on the unit, we're looking at individuals that are in the acute phase of recovery, oftentimes from stroke, but occasionally traumatic brain injury as well. We'll establish a baseline level of cognitive functioning on the unit, and then we'll follow up on an outpatient basis to monitor the recovery and update recommendations to improve quality of life. Occasionally, we'll also get orthopedic patients on the rehab unit as well that are showing cognitive changes or some confusion. Oftentimes there's an underlying dementia that was not noticed by family prior to coming up to the unit, but now that they're around them more, it's being identified. So we'll then again also kind of establish a baseline there and follow up more as an outpatient thoroughly to kind of rule in or rule out what might be going on with that. We're also heavily involved with the Concussion Clinic, trying to get our youth athletes back into the game as soon as possible, but as safe as possible as well. So the Concussion Clinic was put together as the first comprehensive team to assess mild brain injury in our local athletes. We also assess older adults or individuals in car accidents or different injuries that would also end up and result with a concussion. The individual presents to the clinic. They undergo a computer neuropsych screening that's real sensitive to assessing different components of concussion recovery. Following that, those results are discussed with Dr. Purnell, our sports medicine physician, who will look at headache, dizziness, imbalance, other different physical symptoms that may have resulted from the concussion. That information is put together, and we're monitoring the recovery of that individual over time. The biggest issue is that we would like that person to have fully recovered before returning to play. A single concussion is expected to resolve on its own independently. Our concern is having another concussion while you're still in the process of recovering from the initial one. So the point is to monitor that to make sure you have fully recovered before going back to play.